conventionally people are made to understand that cancer is cancer, no treatment, it is like a death sentence. There is this stigma associated with cancer of the breast. They, in spite of knowing it, they don't bring it to the attention of the family members. Cancer is a disease which is of lifestyle.
Cancer is a word that immediately creates fear and panic in a family. But sometimes the biggest danger is not only the disease, it is the delay, the confusion, and the wrong first steps. Today, we are here with Dr. Rajesh Mistry, one of the most distinguished doctors in India when it comes to oncology. He is the Senior Director of the Department of Oncology at Kokilaben Dhirubhai Ambani Hospital, which is also one of the most distinguished hospitals in the country. Dr. Mistry, welcome to the podcast.
Pleasure.
So, Dr. Mistry, today I want this conversation to help families who are confused and who do not know what their next step should be.
Correct.
So, Dr. Mistry, when a family first hears the word cancer, what is the biggest mistake that they make in the first few days?
Like you made in your opening statement, when a diagnosis of cancer is given to a patient and the family, there is panic. Because conventionally people are made to understand that cancer is cancer, no treatment, it is like a death sentence, which is not true in these times because there are a lot of advanced treatment. So the first thing that a patient and the family members should understand is that they should go for a consult with a proper doctor or an oncologist and find out what is the stage, what are the options for treatment, and understand the disease and how it can be navigated, the treatment, and what are the outcomes likely to be. So instead of panicking, one should actually take the disease head on like any other disease that are there in this world.
Mm-hmm. So, doctor, everyone says that early detection saves life. Can you explain this from the medical point of view? What does early detection mean for a surgeon, and how does it actually help the surgeon?
So, like I'm sure everybody knows, cancer we talk about in stages. It starts with stage 1 and then it goes up to stage 4. Stage 1 is the earliest stage and stage 4 is advanced stage when the disease has started at some place but it has affected other various organs in the body. So that is stage 4. Now the aim of diagnosing cancer early is to pick up cancers in earlier stages, preferably stage 1. Because when a patient is diagnosed with cancer in stage 1, the treatment is very easy, not very complicated, not very expensive also, and most importantly, after the treatment, the outcomes are very good. So when we talk about cancer, you talk about cure rates. So, typically if the cancer is diagnosed in stage 4, one can look at cure rates of up to 80, 90, 95% depending upon what cancer one is talking about. So that's why the emphasis on early diagnosis when it comes to cancer.
Okay. So another question, doctor, in India, there's a lot of stigma surrounding cancer. And a lot of families tend to keep this disease silent or, they don't want to talk about it.
Correct.
What do you think this silence costs them?
This is very common, and even today, we get patients who are in very advanced stages, stage 3, stage 4. And one of the reasons, like you pointed out, is that there is a typical stigma associated with the diagnosis of cancer because if, other members of the society come to know that a particular person has cancer, there is this wrong impression that it could be familial. So, if there is a family history of cancer, so kind of they feel that they will be isolated and there may be future problems when it comes to marriages and all this. So that is one of the reasons where where there is this hesitancy on part of the patient in spite of knowing that something is going wrong. Like for example, if we talk of a lady with breast lump, she might have noticed it quite some time ago, but because there is this stigma associated with cancer of the breast, they, in spite of knowing it, they don't bring it to the attention of the family members, or they don't seek any help from the doctor, and then you'll end up with diagnosing the same cancer in a very advanced stage, when it could have been easily diagnosed in stage 1, because diagnosing a lump in the breast is not very difficult. Similarly, for example, in our country, oral cancers, they are very common, but even after having an ulcer or a growth, something which is very easily seen in the oral cavity, people are just hopeful that it is not cancer, it will heal on its own. They keep giving time, and by the time they seek medical help, very often the disease is in stage 2, stage 3, and occasionally in stage 4.
Another thing, doctor, is that patients often believe that the treatment for cancer is decided by a lone doctor. But modern cancer care uses tumor boards
Correct.
to decide the treatment process.
Yeah.
Could you explain more on this? Like, and why does it matter for a tumor board to decide the treatment rather than lone doctor? And what are the benefits of it?
So typically, when we talk of cancer, there are two groups of cancer. One is solid cancers, and then you have liquid cancers, which means blood cancer and things like that. So what I am talking about is more of solid cancers. Now, when the cancer is diagnosed in a very early stage, stage 1, for example, solid cancer, typically the treatment could be simple radiation therapy or simple surgery. But both these options are open. And as you diagnose cancer in advanced stages, stage 2, stage 3, stage 4, the treatment becomes very complex, and no one particular specialty can help the patient. Very often, patients require surgery, they require chemotherapy, they require radiation. So all three modalities comes into play, and unless there is a tumor board, or tumor board is the best way of putting it, but you can have informal consultation, all three specialists, and then based on the diagnosis, the stage, and patient's overall general condition, you decide what would be the most appropriate treatment. Very often patients, they come in stage 4, they are in very poor general condition, and the best thing could be maybe just palliative treatment, painkillers and supportive care and all that. Whereas if the patient comes in stage 1, then when you have a tumor board and the patient actually participates in the decision making, patient is the most important person who decides what treatment he or she wants, because as a group we can tell them this is the ideal treatment based on whatever evidence we have, but patient also should participate and then say that, okay, I want to go for this or that, because for stage 1 cancer, sometimes surgery is also an option and radiation is also an option. So the patient has to then, decide what would be the best. So apart from the tumor board, which is very important for giving the correct evidence-based treatment, patients should also understand what options are available, and they should be encouraged to, decide as to what finally they want to go through.
So doctor, for a patient who is from, say, a tier 2 city, such as Guwahati or Shillong or wherever, where do you think they get lost in the entire process?
The loss starts with diagnosis. Like you said, majority of the times in India particularly, cancers are diagnosed in very advanced stages, and that is not only true for northeast states, it is true for entire country. But what happens is, the access to medical care, particularly advanced medical care for cancer, for example, is not easily available in northeast states, and therefore they get confused as to where to go for the treatment, what would be the best place. And also, more importantly, treatment for cancer is not one-time treatment. It is, surgery, then you have radiation therapy which can go on for 6 weeks, then there will be, say, chemotherapy before surgery, after surgery. So the treatment is not just one time, and then they get lost. They may want to go, to a higher center. But when they realize that treatment will entail staying in that place for 3 months, 6 months, it becomes very difficult. So
Yes.
I think that is where the confusion starts, and they are not able to decide where to and how to go about.
Okay. So, doctor, UzuHealth is trying to reduce this chaos by helping patients take a structured first step. Okay. Report review, online specialist access, at least doing the first initial consultation via teleconsultation, and then taking forward via physical consultation. So where can digital platforms genuinely help cancer patients?
First of all, your platform can first educate the people in large, and also the patients, as to not to panic with diagnosis of cancer. And then you can also guide them as to how to navigate the whole system, and which will be the ideal place to go, what are the options available, and help them in their journey from the diagnosis to treatment. Now, very often, diagnosis is made at stage 3, stage 4. And what one can do is just minimum palliative painkillers, supportive care, and all that. And if the patient knows that this is going to be the treatment, there's no point in rushing to, say, Mumbai or Chennai or Kolkata, because that can be easily done in Guwahati itself, or whichever state we are talking about. So if your platform can help them, say once the diagnosis is made, then you can, contact, or through telecommunication or teleconsult, find out what is the stage of the disease, what are the options available, and if there is an option of, say, surgery or some complicated treatment which requires, patient to go to a higher center, then facilitate them to go to those places. But very often, the treatment is very simple. It is available also in northeast states, and then it doesn't make sense to rush there. So they get through telecommunication the best opinion, what should be the ideal treatment, and then if there is need to come to a higher center, you can help them do that also.
Okay. So until now, we've been talking about general problems that the common people are facing when they're getting when they want access, or when they need healthcare related solutions for their cancer care. But doctor, now I want to shift direction. Could you tell our audience about what are the most latest advancements, or the exciting advancement in the sector of cancer care that you would want more people to be aware about?
So basically, very broadly speaking, there are 3 modalities for treatment of any cancer, solid cancer. One is surgery, second is radiation therapy, and third is medical treatment, which consists of chemotherapy, targeted therapy, immunotherapy. So in each field, there has been a lot of advances. One advance is understanding of cancer biology. So we know what is cancer, how it spreads, what causes cancer very often. So that is one of the advances which has taken place.
So which advance excites you the most right now?
So the aspect which tells us, how to treat a cancer, or what is the best approach for the patient with cancer. That is because, today one shirt, one shirt doesn't fit all. So same way, every cancer has to be treated based on its own merit. So individualize the treatment. Instead of treating all cancers, say oral cavity cancers, with XYZ, you treat somebody with X, somebody with Y, somebody with Z, depending on what type of cancer is there, what is likely to work for that cancer in an individual. So personalizing or individualizing treatment is the most exciting thing that has happened. But apart from that, I want to talk about advances in each of these 3 modalities which are very important in overall treatment of cancer. So when we talk about surgery, for example, now we know that there is precision surgery. We have robotics available. We have minimal invasive surgery, so that we don't have to cut upon the whole abdomen to do surgery, or cut open the chest to do surgery. So that is the most technologically important advance that has taken place in surgery. Minimize the trauma of surgery without compromising on the radicality of surgery, so that the surgical outcomes are both good in terms of cancer outcomes, as well as recovery of the patient and cosmesis. In radiation therapy, we have very sophisticated radiation machines available now, so that the trauma, which is the injury caused to the normal surrounding tissue, is minimized, and therefore the side effects of radiation therapy are less, and patients are able to tolerate it much better, and the controls are also improving because you can give higher doses. And the most exciting advances have taken place in medical management of cancer. So you have chemotherapy, which is standard of care, but we now have targeted therapy, where depending on what type of cancer you are dealing with, what genetic mutations are there, we can treat some patients with simple medicines.
Okay.
Oral tablets like hypertension and diabetes is treated.
Okay.
And there are fantastic results with those medicines. Patient can have one single medicine every day and survive in stage 4 cancer for 4 years, 5 years. Some of them are surviving even more than that.
Okay.
Similarly, now we have immunotherapy, which is groundbreaking, and in certain cases where the tumor is sensitive to these immunotherapy drugs, even in stage 4 patients are having normal life for 10 years and even more, because if it works, the cancer remains under control, though it may not be eradicated with these medicines.
Thank you. That was enlightening. So, doctor, if there was one message you want every Indian family to know when there is suspicion of cancer, what would it be?
So, like you said, diagnosing cancer at an early stage is the best thing, because then the treatment is minimized. But unfortunately, in cancer, when the cancer is in early stages, there are no symptoms.
Yeah.
So one has to, regularly undergo tests to, say maybe annual checkup, not only for cancer, but for hypertension, diabetes, which is much more common in our country than even cancer. So annual health checkup after a certain age is very important. Then there are certain cancers which are screenable, so you can diagnose them even with in a stage where a person has not felt anything. So in that group comes breast cancer. Then you have prostate cancer, cancer of the lung, cancer of the cervix. These are some cancers which can be picked up by screening. So when you screen, you're talking of screening normal individuals. They don't have any complaints. But you screen them so that you can pick up cancer in subclinical or pre-symptomatic stage, where the treatment is going to be very, very effective. So that is one thing one should keep in mind. Second thing is diagnosing it at early stage. So there are certain symptoms, which are associated with cancer. Unfortunately, there is no one symptom for cancer. Each cancer has different complaints and symptoms and warning signs. So, you can check anywhere, there are warning signs given. But more importantly, say for example, you talk about coughing. Now, coughing or blood in sputum can happen with simple things like tuberculosis also. So every patient with cough or blood in sputum is not necessarily because of cancer. But if, say, there is coughing or which is not settling with medical treatment, 7 days, 10 days, then one should not ignore it and, go for higher consultation, which may require a CT scan and, something more. So that is another thing. But the important message that I want to give is that, cancer is a disease which is of lifestyle. So as is your lifestyle, is, you'll have those types of cancers. Now in our country, tobacco is eaten, chewed, that is the form which is most commonly people are addicted to. So you have oral cancers which are very common in our country. But in countries where tobacco is smoked, their cancer of the lung is most common. And so, it is a lifestyle disease, just as obesity is lifestyle, just as hypertension, diabetes are lifestyle diseases. Cancer also is a lifestyle disease. And if you understand that, if people don't pick up the habit of tobacco in any form, people avoid alcohol completely, which are high risk factors for any type of cancer, then almost 50% of cancers that we are seeing now will not be there, because you have a healthy lifestyle. So avoid alcohol, avoid tobacco, you should avoid being overweight, so obesity, so you do regular exercises, and most importantly, eat healthy food which has green leafy vegetables and fruits. Apart from, of course, non-vegetarian person can eat, but there should be right mix of fruits and green leafy vegetables, which we know somehow helps in protecting our individual from cancer. So if these 3-4 things are followed, then we may be able to reduce the incidence of cancer. And then, of course, more importantly, when it is cancer, diagnose it at an early stage, or cancers which are screenable and can be diagnosed in subclinical stage, go for that.
Okay. That was really insightful, Dr. Mistry.
Thank you.
And thank you so much for joining us today's podcast and helping us educate the masses on, like, what cancer is, that cancer is a lifestyle disease, and that cancer need not be treated with fear and panic, but that can be solved with a structured approach. So thank you for enlightening us on this.
Thank you very much for having me here.